Today we're talking about something that stresses out a lot of dog owners: hair loss. Not just extra shedding on the couch, but actual bald patches and thinning coats that make you think, okay, something is wrong. We're covering 5 major categories of canine alopecia today. That's the clinical word for hair loss. And by the end, you'll know what to look for, what it might mean, and what to do next. Parasitic causes, the invasions. Alright, we're kicking things off with the category that involves tiny unwanted guests taking up residence on your dog's body. And the first one is flea allergy dermatitis, probably the most underestimated cause of hair loss in American dogs. These dogs aren't reacting to the fleas themselves. They're having a full allergic response to the flea's saliva. One single bite can trigger intense itching and hair loss that lasts for days or weeks. The classic location is the base of the tail and lower back, so a bald patch right above where the tail meets the body is a major clue. Your actionable tip: check for flea dirt, tiny black pepper-like specks in the coat, and get every pet in your household on a monthly preventive like Frontline Plus or Advantage 2. Treating one pet and not the others is one of the biggest mistakes American dog owners make. Mange comes in 2 very different forms. Sarcoptic mange is the contagious one. Mites burrow under the skin and cause relentless itching so severe that the skin crusts over and hair falls out in patches, usually starting around the ears, elbows, and belly. You know, this is super serious, and I can't imagine how miserable our dogs feel. Buried under their skin are parasites they can't see or reach. Sarcoptic mange can spread to humans too. So if you and your dog are both suddenly itchy, mention it to both your doctor and vet. Demodectic mange is usually not contagious. It's caused by a mite that naturally lives on all dogs. But when immunity drops in puppies or stressed dogs, those mites multiply out of control and cause circular patches of hair loss on the face and legs. Your actionable tip: a skin scraping at your vet is the only way to confirm which type it is. Don't treat mange at home. You need the right diagnosis first. Allergic causes, the detective mysteries. Allergic hair loss is sneaky. It hides behind itching and inflammation and mimics other conditions. Food allergies surprise most owners because we don't assume the food bowl is causing skin problems. But the immune system can react to specific proteins: chicken, beef, dairy, wheat, and that reaction shows up on the skin, especially the paws, around the eyes, and inside the ears. Chronic ear infections combined with paw licking? Food allergy is a serious suspect. The only real diagnostic tool is an 8 to 12 week elimination diet trial with a hydrolyzed or novel protein food your vet selects. Not a blood test, not a hair test. Your actionable tip: log your dog's symptoms and dietary history before your vet appointment. That information genuinely speeds things up. Atopy works like seasonal hay fever in humans, except instead of sneezing, dogs itch. Pollen, grass, dust mites, and mold trigger immune responses that cause chronic scratching and eventually hair loss from all that mechanical damage. The classic sign is paw licking so intense the fur turns reddish-brown from saliva staining. By the way, if you haven't subscribed to Dr. Buddy Explains yet, now's a great time. We cover this kind of content every week. Your actionable tip: note whether itching worsens in certain seasons or after outdoor time. That pattern tells your vet a lot about whether it's environmental or food-related, which changes treatment significantly. Infectious causes, the micro battle. Okay, so this category involves microscopic organisms, bacteria and fungi, that invade compromised skin and make everything worse. Pyoderma is a bacterial infection caused by Staphylococcus, which, wait, I almost said Streptococcus. No, Staphylococcus is the main culprit in dogs. It's almost never the original problem. Usually a dog is already scratching from allergies or mange. The skin barrier breaks down and bacteria move in. You'll see pus-filled bumps, crusty patches, redness, and hair loss. And it can smell bad too. Your actionable tip: visible bumps or pustules mean a vet visit, not a wait and see. Pyoderma needs prescription antibiotics, and the longer it goes untreated, the harder it is to clear. Ringworm isn't actually a worm. It's a fungal infection called dermatophytosis, named for the classic circular lesion with hair loss and a scaly edge. What makes it urgent is that it's zoonotic. It spreads directly from your dog to your family, and kids are especially vulnerable. A round, scaly bald spot on your dog is a significant red flag. Your actionable tip: Get a fungal culture at your vet and wash your hands thoroughly after handling your dog. Keep kids away from the affected area until you have a confirmed diagnosis. Endocrine and metabolic causes. The system glitches. This is the category where hair loss isn't about anything on the outside. It's about what's happening inside your dog's body. Hypothyroidism is when the thyroid gland doesn't produce enough hormone, and dogs with this condition develop a really distinctive pattern of hair loss. It's symmetrical, meaning it happens on both sides of the body in matching patches. You'll also often see weight gain without any dietary changes, lethargy, and something vets call a rat tail, where the tail loses its fur and looks thin and bare. Dogs go through so much with this kind of stuff. And the frustrating thing is that hypothyroidism is often missed for months because the symptoms build slowly and owners chalk it up to aging. Your actionable tip: if your middle-aged to older dog, especially a golden retriever, Doberman, or Cocker Spaniel, is gaining weight and losing hair symmetrically, ask your vet specifically for a thyroid panel. It's a simple blood test. Cushing's disease is caused by excess cortisol, the dog's body constantly flooded with stress hormone. Hair loss tends to center on the trunk, often leaving the legs unaffected. You'll also notice thin skin, a pot-bellied look even without weight gain, and increased thirst and urination. Hurry up and get your dog checked if this sounds familiar. Cushing's can lead to diabetes and serious infections if unmanaged. Your actionable tip: diagnosis requires blood, urine, and sometimes imaging. Don't let it slide because the dog seems okay enough. Cushing's is progressive. Behavioral and nutritional causes. The lifestyle factors. Here's one that catches people off guard. Psychogenic alopecia, hair loss. The dog causes themselves through compulsive licking driven by stress or boredom. Think of it like a person biting their nails, the body expressing psychological distress physically. You'll see well-defined patches in locations the dog can easily reach, like the forelimbs, belly, or flanks, with smooth, intact skin underneath rather than inflammation. Your actionable tip: the fix isn't a shampoo, it's addressing the root cause. More exercise, more mental stimulation, and possibly anti-anxiety medication or a veterinary behaviorist consult. And finally, nutrition. What goes in the bowl shows up in the coat. Deficiencies in zinc, omega-3s, or low-quality protein lead to a dry, brittle coat that thins over time. A fish oil supplement like Nordic Naturals, omega-3, pet or Zesty Paws salmon oil, both popular in the US, can make a visible difference. Your actionable tip: dull coat plus hair loss without obvious skin issues means ask your vet about a diet review and omega-3 supplementation. Hair loss is easy to put off because it doesn't always seem urgent, but alopecia is often the first visible sign of something much more serious, and catching it early almost always leads to a better outcome. Thank you so much for watching. If this helped, give it a thumbs up and share it with a fellow dog owner. Subscribe to Dr. Buddy Explains if you aren't already, ring the bell, and drop your next topic in the comments. I read every single one. Your pup is lucky to have someone paying this much attention. We'll see you in the next one.